Good afternoon. My name is Dana Germana. Today I have the pleasure of giving an educational session on HPV, also known as human papillomavirus. Today's objectives will focus on human papillomavirus, HPV, who is at risk for contracting the virus. I will explain why HPV is a public health risk. The discussion will include evidence-based prevention goals and SMART goals and explore the Healthy People 2030 initiatives. The viewer can then give feedback on today's session, what was learned, and what could be improved. Human papillomavirus, HPV, is the most common STI, sexually transmitted infection. HPV is preventable, and a vaccine is available. HPV has many viral strains, with 40 being known carcinogens, which means cancer-causing. HPV is linked to cancers of the cervix, anus, penis, vulva, and throat. Young sexually active adolescents are at high risk of contracting the virus. Risk factors of HPV include early sexual encounters, lack of circumcision, lack of condom use, internet access, and fears associated with HPV vaccination. Education is often geared towards young women due to the risk of cervical cancer. Frequently, however, education for young adolescent males is not given the same importance. HPV is a serious public health issue since 6 million people are diagnosed with the virus annually. HPV is quickly passed from person to person through oral and genital sexual intercourse. Often males are unaware that they are harboring the virus. To date, there is no definitive diagnostic test for males. Men with a cancer-causing strain of HPV are most often diagnosed with oropharyngeal cancer involving the throat, tonsils, and base of tongue. 1 in 3 men over the age of 15 contract genital HPV, and 1 in 5 have a high-risk type 70% of head and neck cancers are caused by HPV, with it superseding the number of cervical cancers. The longer HPV is in the body, the greater the risk of it developing into cancer. Evidence-based prevention methods. Many people fear immunizations and the healthcare community. So healthcare professionals need to dispel those fears. It is our obligation. Since the conception of the HPV vaccine, thousands of vaccines have been safely administered. Another goal is to increase immunizations in young adolescent boys before their first sexual encounter. Also, educating adolescents on the importance of safe sex, practices such as condom usage, and finally, making condoms available, accessible, and acceptable to young adolescents. The World Health Organization aims to achieve 95% herd immunity. SMART goals are specific, measurable, achievable, realistic, and timely goals. One important goal is to increase the adolescent vaccination rate by 80% in 2026. Another goal is to ensure adolescents complete the 3-dose vaccine series. The Healthy People Initiative of 2030 goal is to increase vaccination rates in America from 58% to an 80% increase. Some strategies for reaching goals include patient reminders, developing a vaccine information system, and school vaccine programs. I hope today you walked away with a better understanding of HPV, that adolescents are at a high risk. HPV can cause cancer. However, HPV is preventable and a vaccine is available. To conclude, I hope you enjoyed this health promotion presentation. Please feel free to ask any questions regarding HPV. To conclude, did you find this tutorial helpful, and how can improvements be made?